The guide that we're going to be talking about in specific today is a tooth-supported guide that also allows the use of... Why should we consider surgical guides when we're talking about placing an implant? And I like to sort of use the analogy that when we use a guide, it helps to illuminate the path of where we want to go. For example, if I said, follow this path, I want you to get to the end of this tunnel here. If we didn't have a light to act as a guide to illuminate the path for us, we may run into a lot of problems, right? We may step in this puddle of water and now we got a wet shoe and a wet sock. We may stumble over one of these rails and bump our head against this rocky wall right there. We may not know that there's a curve coming up ahead. If we knew that and we had a surgical guide, it would be much easier to stay in that pathway and end up with the end result that we have in mind, which is I want to get to the end of this tunnel right there. What is it definitely going to do? Well, certainly a surgical guide can make things safer because it's going to keep us from injuring a lot of vital structures. And when I say vital structures, things that we don't want to find. We may not want to find the floor of the nose or the inferior alveolar nerve or the sinus cavity. The guide that we're going to be talking about in specific today is a tooth-supported guide that also allows the use of depth control. That means that if we set the platform of the guide to allow you to place an implant through the guide, and if you happen to select an 8mm implant, it is not going to let you drill deeper than 8mm. It is not going to let you place an implant deeper than 8mm. I have a lot of doctors saying, boy, I can place an implant with a surgical guide in 5 minutes, and that probably is true. So is the advantage of time savings in the surgery? For sure, it's going to give you time savings in surgery, and that is very important because the least amount of time we're doing the surgery on our patient, the less likely that we're going to induce more trauma to the patient by keeping a flap open or constantly having to go back and forth taking x-rays. Do we have the need for an immediate provisional? Well, if it's in the anterior zone, absolutely. We could support that papilla from the day of surgery. If we utilize guided surgery, then we know exactly where the implant platform is going to be, and we could theoretically order from the laboratory a pre-made provisional, a pre-made biotemp that could either be cement retained or it could be screw retained. My preference is that if we could plan it as a screw retained restoration, it becomes easier to take that on and off if we need to add or subtract to our provisional to help support the tissue, or if we're not getting the tissue response we want, we can start taking away some of that to allow more tissue to fill in. So what's going on with the cone beam? Why is that so important to us? Well, I like to kind of consider like it's giving me x-ray vision. It's letting me see what's underneath the gum. And I tell the patient, if I could just take your gum and peel it away like it was a skeleton right there, I could see exactly what that bone looks like. And if I know what that bone looks like, then I have got a better idea where my implant could be placed, and if I have to do any augmentation, whether that's hard or soft tissue augmentation, to create what I want to do for you, which is a natural looking crown.
Are you enjoying this instructional video? I hope so. If you'd like to receive additional clinical instruction with AGD and ADA approved CE credits, all at no charge, be sure to visit glidewelldental.com/education, where in addition to over 60 on-demand clinical courses, you can also access our weekly webinars along with other valuable content.